People all across the country are devastated. In many instances, their healthcare costs are more than their mortgage costs or their rent, which, by the way, is a first in American history. This is particularly unfair to millennials and younger Americans generally, who will be totally crushed. Workers' hours are being cut, hiring is frozen, totally frozen, and wages are being slashed. If we don't repeal and replace Obamacare, we will destroy American healthcare forever.
आज हम सिकनेस को एड्रेस करते हैं, आवश्यकता है हम वेलनेस को एड्रेस करें। हम बीमारी की चिंता करते हैं, हम स्वास्थ्य की चिंता कम करते हैं, और इसलिए प्रिवेंटिव हेल्थ केयर, पैरामेडिकल फोर्सेस, ये सारी शक्तियों को कैसे जोड़ा जाए। भाइयों बहनों, हेल्थ इंश्योरेंस की बातें बहुत हुई है। 21वीं सदी में हमें गारंटी देनी होगी। हेल्थ इंश्योरेंस से अटकना नहीं है, हेल्थ एश्योरेंस का वादा करना होगा।
They know something is not right here. They are not getting that kind of confidence. They are not getting that kind of assurance that their business is going to lift. Ultimately, who are the beneficiaries of this mission? These are the general public at large. 68% of Indian populations who live in villages earn less than $1 per day. Healthcare is a bigger challenge.
Healthcare in India has assumed a more dynamic form over the last few years, offering exciting opportunities for new reforms and improving stagnant indicators, addressing concerns of access, affordability, and quality across. India's cost efficiency and competency are the biggest advantages over other countries. India's cost of production is nearly 60% lower than that of the US and almost half of that of Europe. Labor cost is almost 50 to 55% lower than Western countries, and cost of setting up a plant too is lower by about 40%. The other benefit India has is skilled workforce and competent technical expertise in comparison to its peers. India has the second largest number of US FDA approved manufacturing plant outside the US and has 2,633 FDA approved drugs. Ladies and gentlemen, the $26 billion Indian pharmaceutical industry, aiming to be among the top 3 pharma markets by 2020, is expected to reach $55 billion in the next 4 years, growing at a pace of 17.90% CAGR. The market size has expanded to USD 36.7 billion in 2016 from USD 6 billion in 2005. India today is standing on the threshold of enormous opportunities where the global market is looking at us with much seriousness to invest and to do business than ever before. The domestic healthcare scenario, though, presents serious challenges as patients' safety and quality healthcare with affordable price has become a subject of tremendous concern. We as a nation must understand that healthcare is key to nation building. Like defense, healthcare sector must be given a topmost priority. Said Satya Brahma, Chairman and Editor-in-Chief of Pharmaleaders Group, while announcing the 9th annual edition of Pharmaceutical Leadership Summit and Pharmaleaders Business Leadership Awards 2016. Satya further says that patient-centered care has now made it to center stage in current discussions of quality and patient care. Pharmaceutical companies, government and healthcare practitioners therefore must ensure that patient-centric healthcare delivery system is key to growth, and there should be greater focus on patient satisfaction and engagement. Healthcare provider must focus on consumers in a way that encourages them to seek all care within the system, optimizing care management and patient engagement. While companies and hospitals are measured on their success through revenue and profit in recent times, the success also should be on compassionate healthcare, and initiatives must focus on medical facilities to reduce patient suffering and meet patient needs. Ladies and gentlemen, pharma leaders feel that leadership, change and innovation are the hallmarks of pharma leaders' preface to grow, and no matter where you are, what you do, when to do. If you innovate and embrace healthcare with change and disruption, you are sure to succeed and be the leader. Pharma leaders strongly feel that the rules of the game have changed. Opportunities are now beginning to be rewarded. The institution Pharmaleaders honors the principles and prominent leadership of the healthcare global leaders, decision makers, and various organizations that are path breakers of leadership excellence. It focuses on the remarkable achievements and noteworthy influence of these leaders, and also throws light on the pivotal role played by them in leading the healthcare transformation to the threshold of the new world. It aims to make a quantum leap and a comprehensive approach in the performance of all those who have contributed immensely to make the vision a great success, and who were able to take the maximum advantage of the opportunities available to them regionally and internationally, and making the best out of those opportunities. Pharmaleaders is an independent, research-driven, new-age healthcare media group that aim to bring the ground report of prevailing healthcare situations and report issues that remain behind the carpet. We are independent, bold and fearless, and we don't get convinced. If asked to be, we convince the society to foster healthcare innovations, reforms, and patient-centric initiatives, because we feel it is always patient first. In India, public healthcare is free, yet years of underinvestment in public health means that facilities are also grossly understaffed and under-equipped. The country also has a massive resource gap of over 4 million health workers, and to compound problems, nearly 60% of existing health workers practice in urban areas. Ironically, with 70% of its people living in villages, often far from healthcare providers, it's clear that there's a lot of room for affordable health services to grow in India. In rural India, almost 80% of the out-of-pocket expenditure is on medicine, whereas in urban areas it is around 75%. The doctor's fees varies between 11 and 14%, and diagnostic tests account for 7 to 8% of out-of-pocket expenditure. Ladies and gentlemen, Pharmaleaders feel that Pharmaleaders 2016 Summit deliberations from industry stalwarts are aimed at shaping the future of definitive plans to address the healthcare issues, improve patient care, and deliver quality healthcare. We at Pharmaleaders are extremely excited to see that there are so many initiatives being taken to put patients first. Our goal, along with many others, is to provide an effective leadership platform to ensure that patients are the ultimate end areas of research. Our ongoing deliberations with healthcare leaders are aimed at bringing comprehensive healthcare reforms, where we work with patients, advocates, industry, regulatory, amongst many others, to share strategies to increase patient involvement and continuous engagement. Pharmaleaders understand that healthcare administration educators are at crossroads. The healthcare sector is rife with inefficiencies, erratic quality, unequal access, and sky-high costs, complex problems which call for innovative solutions. Indian healthcare institutions, especially the public sector organizations, are not educating the stakeholders to be innovative. Clearly, several barriers need to change, including shortages of public health or health administration faculty with appropriate managerial skills and adequate grounding in actual healthcare delivery, global markets, and holistic perspectives. In addition to these faculty-centric barriers, they noted difficulties in finding data on real-world organizations or material integrating healthcare and patients. Ladies and gentlemen, Pharmaleaders is aware that healthcare costs are rising faster than quality is improving. Significant waste in healthcare delivery persists, harming patients, providers, payers, and purchasers. Providers who do the right thing, improve quality, reduce waste, are penalized financially in a fee-for-service reimbursement environment. Healthcare cost and quality data are largely unavailable to purchasers and consumers. So, the market can't reward the good guys, and patients' health conditions must be addressed not just inside a clinic or hospital, but also where the root causes of our most common and costly health conditions are found, where people live, learn, work, and play. Ladies and gentlemen, clearly change is needed, but for healthcare to change, the education of its leaders must change. Innovative thinking really comes from the environment and culture of your organization or workplace. An open environment that appreciates diverse solutions to today's healthcare issues is something that fosters innovation, is what Pharmaleaders believe. Satya Brahma, the charismatic chairman and editor-in-chief of Pharmaleaders, says if we want a more affordable and convenient healthcare system, we must demand it and embrace disruptive innovation. Disruptive innovation simply describes how industries transform to provide increasingly affordable and conveniently accessible products and services to consumers. Pharmaleaders feel that as healthcare consumers, we have a responsibility to not only demand better, more affordable care, but also to put our money where our mouths are. We do have a say in the treatment we need to be well. When we all start acting like citizens, we can turn things around. Healthcare system leaders need a vision of an integrated, enterprise-wide transformation. In addition, the current market pressures will not tolerate small increments of change. Significant organizational changes and dramatic improvement in performance in several key areas are necessary for survival. The transformation pie breaks down into several bite-sized pieces that need some discussion before digestion is possible. Pharmaleaders understand the pulse of the industry. Change in the medical marketplace is not incremental. It is transformational. It is a sea change. Those organizations that transform, realign and reinvent will be the winners, and those that attempt to modify traditional healthcare delivery will be the losers. Combined pressures have come to bear on the medical marketplace, including reimbursement compression, patient volume compression, information technology, and regulatory change. What follows is a very brief overview of the key drivers of change. That is followed by what organizations and practitioners will need to do to create system solutions to meet critical quality and reimbursement metrics and to improve performance, efficiency, quality, safety and satisfaction. Medical practitioners will have to be part of the solution. Remember, 86% of rural population and 82% of urban population were still not covered under any scheme, public or private, to support health expenditure. In rural India, almost 80% of the out-of-pocket expenditure is on medicines, whereas it is around 60% in urban areas. It is therefore now or never. Let's do it now.